Despite making half the population, women's issues continue to be underreported, underrepresented, and underprioritized.
When we look at outcomes for women, we know that there are disparities and that we haven't always historically appreciated those disparities at all.
When it comes to cancer, when it comes to all sorts of different health conditions, unfortunately, Black women seem to have the worst outcomes.
Women's health issues are under threat.
Decisions are being made on behalf of women that are not actually evidence-based, and this is having profound impacts on women's health.
Despite advances that's happening in healthcare and science, it's shocking that the gap in the health between men and women continues to be there and continues to be wide.
There are very prevalent conditions that only affect women that we don't know much about. Endometriosis affects something like 10 to 20% of women of reproductive age, but even in high-income countries it takes 7 to 10 years to get diagnosed.
Women's health issues have been underfunded, whether it's endometriosis, whether it's complications of pregnancy. I think we just don't get as much heat and light shone on our issues. And I think you just have to look at erectile dysfunction to see the disparity. These are clearly disparate.
Most of the research that we have for many clinical conditions has been very male-centric, and this starts right from animal research. Mice, only male mice have been used. Experimental medicine, mostly men, which means we don't know the impact of female hormones on some of those conditions and the impact. And then moving on to clinical trials of drugs, again predominantly male participants, so we don't know if these drugs are harmful to women or not, or if they are not effective or not.
There's data now from the UK government showing that women with endometriosis get paid less as part of the workforce. Not just that, they tend to sort of leave the workplace early. It's a big concern, not just for society, but also for the economy.
It is frustrating because most of these problems happen for women when they are in the prime of their life, in their working lives. And women can't go to work or can't go to their schools or universities because of these issues. And this has a frustrating impact on their career progression, as well as the chances a woman has been denied because her problems are not listened to.
In 2018, Black women in the UK were 5 times more likely to die during pregnancy, childbirth, and the 6-week period after. Those statistics are crazy because we don't account for a huge amount of births, but yet we're the ones that are more likely to die.
Inequalities are not just gendered, they're intersectional.
One of the papers that we published in the Lancet showed that Black women, irrespective of the country that they are in, their outcomes for their babies was much worse than white mothers. Race and ethnicity consistently has a causal effect on babies dying.
Following hearing the stats, I just wanted to create some change. 5 Times More is an organisation that is dedicated to highlighting and changing Black maternal health outcomes, as well as women's health. So we do this in a number of ways. We lobby the government, train health professionals.
The system's not designed for us, so imagine us trying to navigate in a system that's not designed for us.
Some of the ideas and stereotypes of Black women being strong, especially when it comes to childbirth, they are deep-rooted in history and they are embedded in society, and that's part of the problem.
There are other conditions for which there are specific increase in risks associated with the ethnic group. So for example, being South Asian and having an increased risk of gestational diabetes, having a Black ethnic background and being at increased risk of preeclampsia. And so there are some biological reasons for that increased risk, but of course they can be compounded when there's mistrust of the healthcare system and a poor therapeutic relationship between care users and care providers.
I think it's really important that we are aware of these additional disadvantages that women face, and there are also regional inequalities. In cities such as Liverpool, where I work, in this day and age, women's life expectancy is going down. We can't have women dying earlier compared to the advances that we've got in science. So I think we really need to right the wrongs that are happening to women, be it from the geographical inequalities or race and ethnic inequalities or the economic inequalities that they face.
I think in terms of addressing these issues, the onus lies on governments and society. The funding for women's health needs to be changed.
I think it's very clear now that in much of the research, women must be present and active at all phases.
I think there needs to be a lot more representation and equity when it comes to research, everything when it comes to Black health outcomes, because it's just not there, it's not enough.
In recent years, a lot of journals, including Lancet, have actually pre-specified to provide data by sex and gender and as well as give the outcomes.
You end up with data that you have for male versus female separately that can be analysed, published and looked at in the future.
But still predominantly, women's health seems to be the remit of a few of us who are working in this space. Obstetrics and Gynaecology alone is not women's health. I need my cardiovascular colleagues, I need my critical care colleagues, I need my respiratory colleagues, my public health primary care colleagues. Each one of them to look at the problems through a sex and gender specific lens, be it in research or clinical care provision.
How can we make sure that this is just a thing of the past? This isn't something that my daughter will be campaigning about in the next 20, 30 years.
It tends to be 2 steps forward and 1 step back. I think we're making progress, but it can often feel slow.
When you speak to families that no longer have their daughter, their sister, their auntie, it makes it all real for us. That's what really keeps us going.
So it remains a big public health issue now, and we as a journal remain committed to advocate for women's health rights.